Good afternoon. I really appreciate a few minutes to tell you a little bit about my experience. Just to point out, these 5 minutes are labeled my perspective, not necessarily my story, because in truth, there are other people here who could tell you my story better than me. I wasn't necessarily an active participant or completely alert the entire time during resuscitation. So I am an emergency medicine physician, and ironically went to do a fellowship in emergency cardiac care and resuscitation at Virginia Commonwealth University, and was nearing the very end of that when I collapsed on campus. And to the point of the gentleman earlier, the hospital and the system needs a plan for what happens there. Because of where I was, I thankfully was witnessed by 2 people, but they called 911 because the code team was taking too long. And the EMS providers got me to the emergency department, and then my own colleagues had to do things they never really planned or thought about doing for one of their own. And ended up that I had a massive pulmonary embolism, and was also in a place where they could call for ECMO and cardiology, and cardiac surgeons come to the emergency department, surgeons who are actually willing to go do a sternotomy and an embolectomy, which doesn't happen everywhere as well. So I was taken emergently to the operating room and had an embolectomy, and then received my own sort of niche research as well of therapeutic hypothermia. And my family, friends, colleagues had to wait patiently, some very hopeful, some secretly not hopeful, that I would pull through. And it really was the place, the place I was the best. All the things lined up in terms of the day of the week, the time of day, and what was already in place in terms of a comprehensive post-arrest system of care. And so thankfully I was extubated and discharged, and had a great set of resources that were already in place for me to survive and survive well. And so really the important piece for me for the post-arrest care and the survivors and their families is that sort of post-resuscitation, post-survival element, and what needs to be in place to assess and treat patients who do survive. And I look forward to what we as a group and a collaborative can put in place with all these different stakeholders to improve that element, as well as all the other pieces. So thank you.